Assalamu alaikum. Hello my dear student. How are you? Hope you are doing good. I am Dr. Karim Rezwan Hasan, Associate Professor, Department of Anatomy at Newszonebd Medical College, Dhaka. Today my topic of discussion is bones. You may know that in your professional examination there is a particular portion of Viva board where you need to face the bones. Not only the teacher will ask you about the bones and its morphology, but also you need to know in details about the bones. So now we will discuss about the general anatomy of the bones. So let's start. First of all, we need to know the definition of the bones. What is actually bone? In our definition, you can see there are some particular segments where I have discussed about the importance of bones, its criteria. Now, first of all, bone is a living organ. Why it is living? Let's discuss in details. It is living just because it has some properties which is essential to maintain its normal growth and nutritional components. For example, it is having increased blood supply. You know that any living organism needs blood. At the same time, you know that it is highly vascular just because in our body the bones are always growing. So whenever anything is growing, it needs nutrition. So it needs its own vascularity. Maybe you have already know about the periosteal artery, nutrient artery, metaphyseal artery or epiphyseal artery. Why those arteries are present? Those arteries are present because the bones is always in need of constant blood supply and nutrition. Now the third one is mineralized. Why bone is mineralized? Let me tell you, bone is having two types of thing. One is organic part and another one is inorganic part. That inorganic part is composed of mainly different kind of salts, especially the calcium salts. So all the calcium salts, as you know from your biochemistry knowledge, that these are mineralized components. So these minerals are essential for formation of bones. Anytime you need calcium supply, those calcium has to be come from the bones as well. Now the fourth one is constantly changing. Let's discuss it in details. You know that when a baby is born from the mother's womb, it is constantly growing into an adult size. So at the same time, when the baby is growing, its bone is also growing. That means the bone doesn't stay in a particular size. It is always growing. Now you can ask me that after the full growth of the bones, what is actually happening, sir? Because there is no visible growth over there. But yes, there is no visible growth over there after you reach to your full growing period, but there is changes. What kind of changes they are? You know that after the adulthood, when the person is growing into an older form, the bones become fragile because some of the organic part of the bones are lost. At the same time, it is very important to know that when the bone is after the fracture, the bone is trying to regain its normal size and normal shape. Not only that, for the calcium metabolism, we know that the bones is always giving calcium to the blood and also receiving calcium from the blood in required. So this is a very clear way to understand that bone is never rest in peace. It is always growing. It is always changing its morphology in the macroscopical phase or in the microscopical phase. And lastly, it is a hard form of connective tissue. Obviously, in our body, there are different forms of connective tissues. Some are the liquid connective tissues, some of the semi-solid connective tissues, and you know the bones is a very strong kind of organ, so it is hard form of connective tissue. Now, the main function of the bone is to produce the framework of your body. You need to stand still, you need to move, you need to do certain things. So, for those purpose, we are using our bones. Not only that, you know that all the body muscles and all of your body structures are based on the bony framework. Now this is all about the definition of the bones. Now let's see what are the functions of the bones. You can see it is a rigid framework of our body. It has to be rigid, otherwise you cannot stand still, you cannot go to anywhere, you cannot do certain function. So it has to be strong and it has to be rigid. Next, It serves as a lever for the muscles. We know that we are moving different joints by the muscles. Not only that, those muscles are moving the bones and we are doing certain things. Also, it is important for the protection of the viscera. We know that our brain is very much protected by a compact structure that is called the skull. So that skull is not only protecting the brain, but also it is providing a room for the cerebrospinal fluids. Also, we can consider our thoracic cage, where the thoracic cage is protecting the heart and also the lungs and the other important structures. In the pelvis, we are preserving the pelvic organs like urinary bladder, rectum, some of the genital viscera as well. So bones are doing the protection as well. Now, you also know from your physiology knowledge that bones are always producing bone marrow, and those bone marrows are essential to produce the blood cells. And lastly, it is a storehouse of the calcium. The major source of calcium is coming from the bones, and calcium is very much important. As you know, calcium is also responsible for the blood clotting, it is responsible for the muscle contraction, and it is also responsible for the nerve propagations. Now, in the next slide, we will see the composition of the bones. We know that bone is a hard form of connective tissue, but interestingly, in a living bone, there are certain kind of things. Let's see what are the structures. First of all, bone is composed of bone cells, and then it is composed of bone matrix. In the bone matrix, we can see it is having water, which is 5 to 10%, then inorganic component, which is 60 to 70%, and the organic component, which is 30 to 40%. Now, what are the bone cells? There are certain type of bone cells, but we can say there are 4 major type of bone cells: osteoprogenitor cell, osteoblast, osteocyte, and osteoclast. Bone matrix. Now, this bone matrix is actually having the organic part and the inorganic part. These organic and the inorganic part are changed with age, pregnancy, lactation, and some of the metabolic status. Now, these parts, that means the organic and the inorganic parts, are always in changes. Now, let's discuss about the organic part of the bone matrix. First of all, we need to know that what is the source of the organic part. One of the bone cell was osteoblast. Let me tell you, this osteoblast is coming from the osteoprogenitor cell. It is the most active form of bone cell, which is producing the organic part of the bone matrix. There are certain types of organic part of the bone matrix, like the major portion is type 1 collagen fiber, which is about 95%. Also, glycoprotein, which includes osteonectin, osteocalcin, alpha-2-HS glycoprotein. Not only that, we are having proteoglycans, that includes chondroitin sulfate, keratin sulfate, glycosaminoglycan, and phospholipid and the phosphoproteins. So these are the things that is present in our organic part. Let me tell you again, all of these things are synthesized by the osteoblast. Now, what are the functions of the organic part? The organic part is very soft and very delicate kind of structures. As we know that this is actually giving the bones a particular type of properties. For example, it provides tensile strength. What is tensile strength? The bone can stretch without breaking. That is the tensile strength. Then resilience. That means it resists fracture when mechanically overloaded. It can prevent fracture. And lastly, shearing strength. The shearing strength is resist twisting or breaking under pressure. So all of these properties, we can assess that these properties are helping the bones to be steady and strong. It is also preventing any sorts of twisting, any sorts of bending, or any sorts of breaking. And that's why the bones are always, even under pressure, it can resist fracture. Now, there is important and interesting things you may be asked in your exam. if you want to remove the organic part of the bone, then what you have to do? Yes, when you want to remove the organic part of the bone, you can burn the bone. If you can burn the bone, the organic part will be burned out and the bone became brittle. Even with a single knock, the bone will be broken easily. So that is the thing. In the older age, this organic part of the bone is usually decreased, and that's why in the older people the fracture is very common. Now the inorganic part. You can see in the inorganic part, the source of the inorganic part is mainly from the diet. So through your food, you are taking the inorganic part. Your body cannot synthesize the inorganic part by itself. So the major component of the inorganic part is calcium. As I mentioned earlier, the calcium is forming different kind of salts like calcium carbonate, calcium oxalate, calcium phosphate, calcium citrate. Not only that, manganese, sodium, chloride, potassium, fluoride, citrate, sulfate, hydroxycarbonate crystal, hydroxyapatite crystal of calcium phosphate, and non-crystalline calcium phosphates are there. So most of the inorganic part is coming from the calcium, as we can see, and there are some other minerals also. Let me tell you, the mineralized component of the bone is also gradually decreased with age. So in the older age, we usually suggest the people to take some of the calcium forms of food and also some calcium tablet. Now, what are the functions of the inorganic part? In the inorganic part, we can see there are two properties, hardness and rigidity. The inorganic part is mainly giving the strength of the bones. Hardness means state of being hard. That means it is hard form of connective tissue, and that hardness is coming from the inorganic part. That means from the calcium. And other thing is rigidity. Rigidity means state of being rigid. That means it is always try to prevent any sorts of changes. So these two properties are under inorganic part. Now, interesting question is, if your teacher asks you that how can you remove the inorganic part, what you need to do? As we can see, the inorganic part is mainly formed by the different kind of salts, so it is very easy to remove it by using acid. What type of acid we can use? From the slide you can see we can use 2% nitric acid or EDTA. EDTA means ethylene diamine tetraacetic acid, and these are the calcium chelator agents. When you dip the bones into these solutions, this kind of acids, the inorganic part of the bones will be removed, and when the inorganic part is removed, the bones became so soft and friable. You can even tie the bone in a knot. That is very interesting. Now, in the next slide, we can see the gross structure of the bones. The bones is composed of outer compact part and inner spongy part. The outer compact part is actually having the Haversian system. We will discuss the Haversian system in the coming days. Now, the bone is mainly surrounded by a layer of connective tissue that is called the periosteum. And some of the long bones are having a cavity inside that is called the medullary cavity. And usually, the medullary cavity contains the medullary substance that is called the bone marrow. And that bone marrow is actually inside a long bone, usually yellow bone marrow. But in the spongy part of the bone, there are also some bone marrow which are red bone marrow. Now let's discuss about the periosteum. As we can understand, the peri means peripheral and osteum means bones. So the structure which is actually surrounding the bone is the periosteum. What is the definition of the periosteum? You can see in the periosteum the definition includes three parts. It is a fibrovascular cellular layer that covers the outer surface of the bone except its articular surface. That means it will totally cover the bone, but it will not go into the articular surface. Why? Just because the articular surface is mainly covered by a hyaline cartilage, that is called the articular cartilage. Periosteum will never go over the articular cartilage. From the definition, we can see that the periosteum is actually having three layers. The outer fibrous layer, which is mainly composed of collagen fiber and the fibroblast. Then the middle vascular layer, which is mainly composed of periosteal blood vessels. And lastly, the inner cellular layer, which is actually having osteoprogenitor cell. From our previous discussion, we know that the osteoprogenitor cell is mainly forming the osteoblast, and that osteoblast is synthesizing the organic part of the bone matrix. Now, the outer fibrous layer. The outer fibrous layer, from our discussion, we already know that it is composed of mainly collagen fiber, and it is the most strongest layer we can say. This outer fibrous layer is binding with the innermost layer by some particular type of collagen fibers, which is known as Sharp's fiber. It is very important for the viva examination. It is the outermost layer, and that's why it is responsible for the protection, and also it maintains the shape of the bones. Not only that, as it is the outermost layer, most of the muscles, tendons and ligaments are attached on it. Then the middle vascular layer. In the blood supply of the bones, we will discuss about the periosteal blood vessels, but right now you have to know that the bone is taking nutrition not only from the nutrient artery but also from the periosteal arteries. So in the periosteal arteries, these layers are actually, middle vascular layer includes those periosteal arteries which are numerous, and they are coming from the neighboring systemic arteries. Now the inner cellular layer, which is composed of the osteoprogenitor cell, as I said, and those osteoprogenitor cell will form the osteoblast, and that osteoblast will synthesize the organic part of the bone matrix and thereby helps for the bone growth. Not only that, after having a fracture, when the bone is healing, at the same time, those organic part, that osteoprogenitor cell will produce the osteoblast, and that will give the organic part, and ultimately inorganic part with the calcium, they will heal the fracture after the fracture. And when any new bone formation happens, that is called the callus. Today our last topic of discussion is endosteum, and you can see endosteum, endo means inner, osteum means obviously it is the covering of the bone, so the innermost covering is called the endosteum. Endosteum is mainly covering the inner aspect of the bone, that means the medullary cavities and some of the small cavities in the spongy bones. It is having the almost same property like the periosteum, but interestingly it is devoid of any particular layers of fibrous connective tissue, vascular layer or the cellular layer. It is mainly composed of very thin layer of connective tissues and some of the osteoprogenitor cells. My dear students, today I have discussed about the first portion of the bones. In the coming days, I will continue my discussion. Thank you very much for your patience hearing.